One of the more successful procedures that we do is anterior cervical discectomy and arthroplasty, or artificial disc. Many times we develop degenerative changes in our cervical spine, and that can result in a ruptured disc pinching a nerve or a bone spur that pinches a nerve. If we're on the younger scale, and that's usually typically under 60, sometimes we like to do an artificial disc rather than do a fusion, because the job of the artificial disc is to allow you to have maintained segmental motion. So when we look at the anterior cervical spine, the disc is the spacer between the bones. There tends to be more motion in these lower two segments, and those are the ones that wear out most commonly between C5 and 6 and C6 and 7. So if you have a relatively well-preserved disc height and you have good motion in your cervical spine, you don't have a lot of arthritis in the back, you're a candidate for an artificial cervical disc. The nice thing about the artificial cervical disc, as compared to the fusion, and not everybody's a candidate for the artificial disc, is that you are allowed to maintain motion after we put the device in. This is an example of an artificial cervical disc. It's called the Mobi-C. It's now a Zimmer product. And essentially, as with most artificial discs, it's a sandwich of titanium, plastic, and titanium. And so after removing the disc and taking away the offending compression on the nerve root or spinal cord, we insert the device into the disc space, and it allows us to still have motion. So you can still flex, extend, rotate, and bend laterally. And that relieves the physiologic stress on the adjacent levels. Unfortunately, when we do fusions, sometimes the adjacent levels can wear out, and that can require another operation within 5 to 10 years.